The room is quiet, almost too quiet. A blood pressure cuff wraps around an arm. The fabric tightens. The machine hums softly. A few seconds later, numbers appear on the screen. Then the cuff is moved to the other arm. Another reading. Another set of numbers. And suddenly, something doesn't make sense. The left arm shows one blood pressure reading. The right arm shows another. For many seniors, this moment creates immediate concern. Which reading is correct? Is something wrong with my heart? Should I be worried? These are important questions because the answer is not always as simple as people think. Most of us grow up assuming that blood pressure should be exactly the same in both arms. After all, the blood comes from the same heart. The same heartbeat pushes blood throughout the body. So why would one arm show a different number? The truth is that small differences are actually very common. Your body is not a perfectly symmetrical machine. The arteries that carry blood to your left arm and right arm follow slightly different pathways. Tiny variations in blood vessel size, blood flow resistance, muscle position, and even arm dominance can create small differences in pressure readings. In many healthy people, a difference of a few points is completely normal. But there is an important distinction between a small difference and a persistent one. And that distinction matters. Imagine standing beside a river that splits into two streams. If both streams flow freely, the water moves smoothly in each direction. But if one stream becomes narrower because of rocks or debris, the flow changes. Water pressure shifts. The movement becomes uneven. Something similar can happen inside the arteries. Over time, cholesterol deposits, calcium buildup, inflammation, and aging can gradually affect blood vessels. These changes often happen silently. Years may pass before a person notices any symptoms. Yet sometimes the first clue appears during something as routine as a blood pressure check. A consistent difference between arms can act like an early signal that blood is not moving equally through both pathways. And here is what makes this particularly important for older adults. As we age, our arteries naturally become less flexible. The vessel walls gradually stiffen. Blood vessels that once expanded easily with every heartbeat become more rigid. This process is normal to some extent. However, when additional narrowing develops in certain arteries, the difference in blood pressure between arms can become more noticeable. The body rarely announces these changes with dramatic symptoms. Instead, it often whispers. A number slightly higher here. A reading unexpectedly lower there. A pattern that repeats itself quietly over months or years. The challenge is that most people never notice the pattern. They measure one arm, record the number, and move on with their day. But sometimes the body is revealing a story that deserves closer attention. Doctors have known for years that measuring blood pressure in both arms can reveal information that a single reading might miss. In fact, many medical organizations recommend checking both arms at least once, especially when blood pressure is first being evaluated. Why? Because the higher reading often provides the more accurate picture of cardiovascular risk. That surprises many people. If your left arm shows 130/80 and your right arm shows 142/84, it may be tempting to focus on the lower number because it feels reassuring. But physicians generally pay attention to the higher reading when differences are consistent. The reason is simple. The lower number may not reflect lower blood pressure throughout the body. Instead, it may reflect reduced blood flow reaching that particular arm. This can occur when an artery supplying the arm becomes narrowed. One artery that doctors often think about is the subclavian artery, a major blood vessel that delivers blood toward the arms. If narrowing develops there, pressure measured beyond that narrowing may appear lower. The result? One arm may consistently show a lower reading than the other. This does not automatically mean something dangerous is happening. But it does mean the finding deserves attention. Research has shown that larger differences between arms can sometimes be associated with increased risk of cardiovascular disease, stroke, and peripheral artery disease. Again, the key word is sometimes. A blood pressure difference is not a diagnosis. It is a clue. And clues help doctors decide whether further evaluation is necessary. There are also everyday factors that can temporarily create uneven readings. Perhaps one arm was positioned slightly higher. Perhaps the cuff was too loose. Perhaps the person had recently moved, talked, crossed their legs, or felt anxious. Even room temperature can influence blood pressure measurements. That is why medical professionals do not draw conclusions from a single reading. They look for consistency. They repeat measurements. They compare results over time. Patterns matter far more than isolated numbers. For seniors monitoring blood pressure at home, this principle is especially important. A single unusual reading should not trigger fear. But repeated differences deserve discussion with a healthcare professional. The goal is not to become worried about every fluctuation. The goal is to become aware. Because awareness creates opportunity. Opportunity to identify problems early. Opportunity to protect the heart. Opportunity to preserve healthy circulation before symptoms ever appear. Many serious cardiovascular conditions begin quietly. Long before chest pain. Long before shortness of breath. Long before emergency rooms and urgent procedures. The body often sends subtle signals first. And occasionally, one of those signals appears through a simple comparison between the left arm and the right. There is another reason this topic matters so deeply for seniors. Many people assume that if they feel fine, everything must be fine. But circulation problems often develop in silence. Arteries can narrow gradually over years without causing noticeable discomfort. Blood flow can change little by little. The body adapts so effectively that a person may never suspect anything is happening beneath the surface. That is why routine monitoring remains one of the most powerful tools in preventive health. Not because numbers are everything, but because numbers can reveal changes before symptoms arrive. If you measure your blood pressure regularly, consider checking both arms occasionally, especially if you have never compared them before. Sit comfortably. Rest for several minutes. Keep both feet flat on the floor. Avoid talking during the measurement. Follow the instructions for your monitor carefully. Then compare the results. If one arm consistently produces a higher reading, that arm is often used for future monitoring. And if the difference repeatedly exceeds about 10 to 15 millimeters of mercury, it is worth discussing with your healthcare provider. Notice the word discussing. Not panicking. Not assuming the worst. Simply bringing valuable information to someone trained to interpret it. Too often, fear causes people to avoid information. Yet knowledge is what allows action. Knowledge allows questions. Knowledge allows prevention. And prevention remains one of the greatest gifts we can give ourselves as we grow older. Your heart works tirelessly every day. More than 100,000 beats. Day after day. Year after year. Without applause. Without recognition. Without rest. The least we can do is pay attention when the body offers information about how that system is functioning. Sometimes that information arrives as fatigue. Sometimes as shortness of breath. And sometimes it appears as two blood pressure readings that don't quite match. A small detail. A simple observation. A quiet message hidden in plain sight. And listening to that message may make a bigger difference than most people realize. If you found this information helpful, take a moment to let us know in the comments. Have you ever checked your blood pressure in both arms, and were the numbers different? And if someone you care about is over 60, share this video with them. A simple blood pressure check today could lead to an important conversation tomorrow. Because when it comes to protecting your health, the smallest clues are often the ones that matter most.